Thank you so much, everyone, and good afternoon. I hope you're enjoying the virtual conference so far, and I'm really excited to be moderating this session on regional signs of climate change and environmental disruptions with four really excellent panelists. My name is Hannah Antonucci, and I'm the Partnership Coordinator at the Planetary Health Alliance. And today we're having this conversation where we'll be framing and introducing topics for the upcoming concurrent sessions. So without further ado, I'd like to start with community and public health with Dr. Kent Boyd. Dr. Kent Boyd is an educator with the University of Minnesota Climate Adaptation Partnership, co-strategic director for the Planetary Health North American Regional Hub, and co-chair of the Alliance of Nurses for Healthy Environments Global Nurses Climate Change Committee. Kent focused his doctoral studies on planetary health, community climate adaptation and resilience, and transformative systems change. In his current role, he educates individuals and communities across Minnesota about the intersections of climate change and health and the strategies to stay safe and build resilience. So without further ado, I'll turn it over to Kent to talk about community and public health.
Thank you, Hannah. Thanks everyone for joining us. I have the task of discussing public health and community health and the intersection with planetary health, those challenges that we see. No small feat, but we have 10 minutes to it, so we'll jump in. As Hannah mentioned, my name is Dr. Kent Boyd. I'm from the University of Minnesota Climate Adaptation Partnership. Next slide, please, Hannah. So when thinking about the challenges, the planetary health challenges in community and public health, I like to focus on these two models and frameworks. Those familiar with public health are well aware of the social determinants of health, and those in planetary health are familiar with the ecological determinants of health. And these two overlap in many different ways, but we can start to see how that may look as ecological determinants of health focus on those direct health impacts, but we also know that social determinants of health have similar health impacts depending on the social determinant that we're looking at. For the sake of this presentation and time, we're only going to focus on a couple of these ecological determinants of health: air pollution, food and water safety, climate change, and then mental health and well-being. And I'll provide some strategies at the end as kind of a teaser for my concurrent session, which will go into some of what's happening regionally related to planetary health solutions for community and public health. Next slide, please. As we're going through these different hazards or ecological determinants of health, it's important to remember that these do not happen uniformly across populations, that we see pregnant people, youth children, older adults, and those with chronic conditions usually have physiological predisposition that makes them more susceptible to these hazards. Also, Black, Indigenous people of color, depending on systems of oppression and racism, have put them in communities and in areas where they're more susceptible in greater contact with these different hazards. And then also outdoor workers in low socioeconomic status with the exposure to these different ecological determinants of health as well. Next slide, please. Thank you. You're ahead of me. So I tried to go through with each of these hazards and mix in some Canadian examples, some North America examples, as well as some Minnesota examples, because that's where I primarily work, is in Minnesota and across Minnesota. When it comes to air pollution in Canada, what we've seen is that the last 3 consecutive years have been severe wildfire seasons, 2023 being the worst on record, 2025 being second. In 2023, that wildfire season released more greenhouse gas emissions than most countries, except for China, India, and the United States. Next slide, please. Outside of wildfire smoke and wildfire pollution, we also have other pollutants that impact the communities across North America. Specifically in the United States, 39% of Americans live in places with levels of ozone and particulate matter above the healthy guidelines. And in the United States, 34 million Americans live with some sort of chronic lung disease, 25 million of those being asthma. So we already have that pre-existing condition, exposure to unhealthy levels of air pollution, and then wildfire smoke events and other pollutants are cumulative to those exposures. Next slide, please. In Minnesota, we've seen a shift in both our source of air quality alerts to being more wildfire, where it was before ozone, and also an increase in the amount of air quality alerts annually. And again, if we look at this as an accumulation to what communities are already experiencing at baseline, we see that low-income people and BIPOC populations are exposed at greater percentages than the state average to air pollution over healthy guidelines. Not listed, but important to note, 2025 was the second worst wildfire pollution year in Minnesota, and it was the first time that we reached the hazardous level on the air quality index. So the first time for the state. And at sometime in June, Grand Portage, which is in northern Minnesota, was the second worst polluted city in the world because of the wildfire smoke. Next slide, please. This one is a bit more regional. I think these concerns are expanding across North America. But what we're seeing is a concern for PFAS, or per and polyfluoroalkyl substances, in our groundwater, our surface water, and our soils, as well as in our drinking water. These have been associated with altered immune and thyroid function, liver disease, lipid and insulin dysregulation, kidney disease, and adverse reproductive and developmental outcomes. We're also concerned for microplastics in our food and water, land, water, animals, and humans. And again, this has been associated with cancer, heart attacks, and reproductive problems. And then not necessarily a safety issue, but I wanted to highlight that Americans consume more than 3 times the global average of red meat. This is important when it comes to planetary health because cattle ranching is the leading global cause of deforestation and a significant greenhouse gas emitter. When we're looking at climate change, we're seeing an increase across the United States in the average annual temperature. We're seeing that this isn't uniform across the United States. Next slide, please. In Minnesota, what we've observed is that northern Minnesota is warming faster than southern Minnesota, and that our winters are warming faster than any other season. This is important because this also matches Canada and other northern areas where winters are warming faster, as well as the northern latitudes are warming faster. Next slide, please. Canada is warming at double the global rate. There's an increase in winter precipitation everywhere across Canada over the 21st century, according to projection models. And then there's also concern for sea level rise and ocean acidification along the coasts, the Canadian coasts. Climate change can also lead to an increase in frequency, intensity, and/or duration of disasters experienced. The United States has been tracking billion-dollar weather and climate-related disasters since about the 1980s. Last year, there were 23 individual weather and climate-related disasters that totaled over $1 billion. And those 23 in total cost the United States $115 billion. Since they started recording these damages or calculating these damages in the 1980s, the United States has spent over $3 trillion on climate and weather-related billion-dollar disasters. And these events have also totaled 17,000 deaths. Next slide, please. In Canada, it seems similar. I don't know that the data exists, or if it did, I couldn't find it. But the cost per disaster is 1,250% more than it was in the 1970s. There are concerns that 10% of households across Canada are at very high risk for flooding. There are 3 times more disasters than the 1980s. And in 2021, there was a heat event in British Columbia, which was the deadliest disaster in British Columbia's history, where 619 people lost their lives. Next slide, please. And then finally, looking at mental health and well-being, some of the concerns with planetary health, biodiversity loss, climate change, et cetera, are the loss of natural spaces because of land use management, but also because of the changes in the inability for these natural spaces to adapt in time, leading to anxiety, depression, solastalgia, and other mental health conditions. With some of the events that we see or have or project to see, we also can anticipate decreased time spent outdoors in nature, not only because of land use and some of those other disasters and things, but also for those that like to recreate outdoors. With heat events, we've seen an increase in nighttime temperatures compared to daytime temperatures, which can lead to decline in quality of sleep, also leading to exacerbation of health illnesses as well as mental health and well-being. And then we know that these disasters compound on one another, especially in those susceptible communities. And if they don't have the resources or treatments available to address the needs after an event, then that will just accumulate over time and become more and more impactful on those populations. Next slide, please. Okay, I'm really close. I just wanted to highlight this again. This is only for the United States, but there is a decline in social connection across the United States, and this is even before COVID-19. So the diagram on the charts on the right are from the U.S. Surgeon General in 2022 or 2023, excuse me, where it identified that 50% of Americans feel lonely. We know that this is associated with 29% increased risk of heart disease and 32% risk of stroke. We also know that strong social networks can positively alter the trajectory of disaster response and recovery. Next slide, please. And then I will briefly just touch on two strategies and solutions. Again, come to the concurrent session for more detail on this. But I guess first and foremost is that the solutions to the challenges that we're seeing in community and public health don't have to be sacrifices for people. There is a sweet spot, if you will, of that's identified in well-being economy and this donut economy by Kate Raworth, where we can serve people and the planet in a sustainable way. Next slide, please. And then also focusing on community resilience. Communities and individuals overwhelmingly have expressed concern or alarm to climate change and global warming, as well as other environmental impacts. And so there's a real need for and possibility with focusing on community resilience and implementing some of these strategies and solutions to address those challenges that I highlighted before. And the last slide. Thank you all.
Thank you, Kent. Next, we'll have Joe Bjorgaard talk about hospitals and outpatient practices. Joe Bjorgaard, DNP, RN, PHN, CSSBB, is a nurse leader based in St. Paul, Minnesota, working at the intersection of health innovation, leadership, and planetary health. A proud graduate of the University of Minnesota, Joe is especially grateful to return to this community and share in learning together. Her work is grounded in a deep commitment to advancing climate and health solutions through education, advocacy, and systems change. Joe is the founding director of the Rise Climate Plus Health Collective and serves as a senior climate and health manager at the Climate Advocacy Lab. She also serves as a board member and community chair for the Minnesota-based Health Professionals for a Healthy Climate and as the operations director for the Planetary Health North American Regional Hub. Across these roles, Joe's focused on bringing people together, building partnerships across sectors, strengthening leadership, and supporting health professionals to take meaningful community-centered action. She's passionate about creating spaces where ideas can grow into real-world impact and where we can collectively imagine and build a healthier, more resilient future. So I'm going to bring up Joe's slides and let her take it away.
Wonderful. Thanks so much for the introduction, Hannah. Can everyone hear me okay? Okay, great. Well, it's really an honor to be here. In the next 10 minutes or so, I'll focus specifically on what we're seeing within healthcare and clinic settings across North America. We can go to the next slide. Thanks. As many of you probably know, planetary health and all of the related crises can feel like really big abstract issues. But in healthcare, the impacts are very immediate. We see them all the time. As a nurse providing clinical care, this all became very real and visible for me. I saw the impacts of climate-related issues in my everyday practice and patient care. And I imagine that many of you have seen something similar in your own practice. We're seeing more and more patients coming in with heat-related illness, worsening respiratory conditions during poor air quality events, and disruptions to care during extreme weather. These drivers of health conditions aren't labeled as climate change in the EMR or the patient's chart, but they are absolutely shaping who shows up, how sick they are, and how we're able to care for them. And I think that's one of the challenges that we see so often. We're experiencing this every day in healthcare, but we don't always name it as such. We can go to the next slide. Thanks. And importantly, just as Kent said, these impacts are not evenly distributed. We see the greatest burden among patients who are already vulnerable, older adults, low-income communities, communities of color, those with less access to cooling, clean air, or consistent health care. So climate change and the other breached planetary boundaries aren't just environmental issues, they are health equity issues that are already showing up in our systems very loud and clear. And the reality is that healthcare is a significant contributor to environmental harm. In the US, the healthcare sector accounts for nearly 10% of emissions, driven largely by supply chains, energy use, and waste. And it's the largest emitter among global health systems. In comparison, Canada's healthcare sector is responsible for about 4.6% of the country's total emissions, and it's among the top 10 largest emitting health systems by country. So healthcare sits at an important dual role, responsible for caring for health while also contributing to the drivers of poor health. We can go to the next slide. Thanks. Despite some of these system realities that I just mentioned, there is real progress happening. Many health systems are beginning to measure emissions. They're setting reduction targets and wonderful goals, and they're investing in sustainability initiatives related to energy, waste, or procurement, for example. They're aiming to reduce their contributions to environmental harm. We're also seeing more attention to climate resilience, so how systems prepare for extreme weather and maintain continuity of care during climate-related events. And this is all meaningful and very hopeful progress, yet it's still pretty early and it's quite uneven. And progress is not linear. So we've seen federal momentum shift, especially in the United States, which has significantly impacted this work. And in addition, much of this is done on a voluntary basis, and adoption varies widely across systems. So while there is real momentum, it is still fragmented and not yet occurring at the scale needed to meet the urgency of the moment. Next slide, please. And despite all of this progress, we still see a significant gap between intention and implementation. We have goals, we have commitments, and we have some fantastic initiatives, but we don't yet have this work embedded into the core of how healthcare operates at scale. It's often siloed, separate from quality operations and clinical care. And even with growing momentum, in the US, only about 29% of hospitals are publicly reporting emissions, and that's according to the National Academy of Medicine. So while progress is happening, it is far from universal. I do see awareness and engagement growing among clinicians, but we haven't quite translated that into widespread leadership or widespread engagement. But it's not simply a knowledge gap that we're seeing, it is an implementation and a workforce gap as well. Next slide, please. So we'll talk a little bit about where the work needs to go. It needs to go from isolated efforts to really system level change. So first, sustainability and planetary health needs to be integrated into care. It has to be embedded into how we define quality, how we deliver care, and how health systems operate, not treated as an add-on, as it often is. Second, we need to activate the workforce. And for this audience, that may mean nurses. Nurses are consistently ranked as the most trusted profession. You are all deeply connected to patients, families, and communities. And we as nurses see the real impacts of these issues in everyday care. Healthcare also has a massive amount of influence economically, politically, and socially. But we haven't yet tapped into this and activated the workforce, and nurses in particular. So we really need to do this at scale to drive the change that is needed. And third, we need to shift upstream toward planetary health. So this means moving beyond treating illness to protecting health at its source, recognizing that human health is deeply connected to the health of our environment, our communities, and the systems that we depend on. So this brings me to the question, what does this actually look like in practice? And I think that's the question that is posed so often. So next slide, please. If you also have this question, we're going to continue this conversation in the panel that follows in the hospital and outpatient settings track. So we'll explore how this work is actually showing up across hospitals and outpatient settings. And if you share a common passion for this workforce activation and culture change, please feel free to connect with me offline. I would be excited to chat more about it. And that's all I have. I'll pass it back to you, Hannah. Thank you.
Thank you, Jo. Next, we'll have Dr. Angelica Walton talking about nursing and nursing education. Dr. Angelica Walton serves as the director of the Center for Planetary Health at the University of Minnesota School of Nursing and Research and Scholarship Director for the Planetary Health North America Hub. She's a clinical assistant professor and scholar whose work focuses on preparing future health system leaders to address complex planetary and community health challenges through systems thinking, interprofessional collaboration, and values-based leadership. So I'm going to hand it over to Angelica right away.
Thank you, Hannah. I'll start by saying good morning or good afternoon, depending on where you are coming from today, while Hannah gets these slides pulled up for us. I missed the memo on the robustness of my of my bio, but hopefully you get a little bit more depth on the work that I'm very passionate about and do as we go through this presentation and conversation over the next 10 minutes. So I'll start just by saying that I'm here representing the work, both past and present, of our incredible team at the Center for Planetary Health, and really to zoom in on the challenges and opportunities facing nurses and nursing education. And I hope in this discussion to share about both the shared challenges that we face and the opportunities that we're really leveraging in this moment to teach and prepare our future nursing workforce with creativity, with love, with compassion, and that value-based leadership that the world is really in demand of right now. We're currently in this like transformative and collective experience of what we maybe all know to be the great transition, right? Where the health of the living world can no longer be separated from the health and the quality of the humans who are here to steward it. And the crux of our most complex problems that we're experiencing as a workforce, as a discipline, are each systemically rooted in the forces driving humans' evolving disconnect with Earth systems. And we often hear that planetary health is one of the greatest challenges of our time, but for nurses and midwives, it's more than a challenge. It's actually a calling to restore planetary health and really return the profession back to its roots of care and healing, and the profession's capacity to return humanity back to its roots of care and stewardship. Next slide. So what all of us on this call already know is that nurses have never been bystanders in this space. From the very beginning of this work, nurse leaders have been architects of the Planetary Health Education Framework published in 2021 in collaboration with the Global Consortium on Climate and Health Education. Our nurse leaders in this space, many of them we've heard from throughout this forum today, many are leading the cultivation of this forum today, have helped define these 5 core domains that now guide global health curricula: interconnection with nature, systems thinking, movement building, equity, and the role of care. And this has not been work that's just added frameworks and chapters to textbooks. Nurses have actually helped to build a new house for health education to live in, and other professions are really starting to join. Other health professions are really starting to join in. This has also guided new metrics and goals based on values and quality to move towards through tireless efforts of many of our leaders over the last few decades. So I just want to uplift those leaders and say thank you, because we all have the privilege in this present time to continue building from this and to help continue shaping this work forward into meaningful directions that re-engage nurses, practitioners, nurse leaders with communities, with land, with more ways of knowing health, with deeper cultural humility, capacity to connect, sustain, and with this enhanced bioregional understanding, all in order to help realign us back to a greater ecological consciousness. Next slide. In terms of challenges, despite our progress, we're facing a social landscape that is defined by fragmentation right now. We are in the midst of what I often in my work refer to as a disembodiment crisis. Social isolation, rising inflammatory-based conditions because of an overstimulated nervous system, chronic stress, complex comorbidities, mental health challenges, and a patient acuity demand that is unmanageable for any workforce, no matter how well staffed it is. And our students are seeing rising mental health challenges, attention deficit disorders, social discomfort, dependency on technological devices, and behavior change that will really challenge the role each are able to play in cultivating healthy workplace cultures. And so our current systems treat humans as separate from the earth, right? That anthropocentric view that sees nature as a resource to be used rather than a system to be a part of, or a place to visit or see as out there rather than a place to turn inward into being and knowing oneself as nature. So this design-driven dissonance is a root cause of the wicked issues we see in our classrooms and our workforce today: the rise in eco-anxiety, the health impacts of social isolation, and really the trauma of ecological loss. And the opportunistic part of all of this is that all of it is happening by design. Next slide. So with that in mind, this time really calls for nurses and nurse educators today to really zoom in on this core domain of the Planetary Health Education Framework, returning to interbeings within nature. We really have to rewire and rethink how we're teaching and learning. It's no longer enough to teach nurses about the parts of a person or the parts of an environment and how those two things interact with one another. We have to really shepherd each other in this community forward towards more immersive and embodied learning experiences, returning to the ways of curious discovery that once shaped our relationship with the world. And it's truly about relational care ethics in nursing education and the strategies that we take to cultivate that. So this means education that restores our relationship with Earth systems. And we need curricula that actually get students out of the lab, out of the classroom, and into the environment, whether that be the environment outside or the one inside of themselves, teaching them strategies to foster a stronger capacity for deep listening to the land as much as they listen to a heartbeat. And so part of our center's mission at the University of Minnesota right now is to really get our students, our faculty, and our pedagogy to align hyperlocally, bioregionally, and shift from teaching facts about the environment to fostering greater opportunities for connection to happen, for ecocentric ways of being to change us, to change the ways we feel and sense life and our capacity to respect it and interact with it. Next slide. So this brings me to talk a little bit about the eco-social partnership framework, which kind of builds on the planetary health education framework and provides tangible strategies into the nature of how we do this inside and outside of the classroom. And it's about building culture from the roots and not from the top. We know that nursing is inherently a creative practice. It is the art and science of healing. And so by integrating creative practice and competency development, we can move nurses out of the hospital kind of ivory tower and back into neighborhoods, back into communities with the people and also with the land. And so much of our strategic setting right now, our strategic objectives as an institution are centering on changing how we train nurses to be public health leaders, planetary health leaders, who can actually see communities, trees, air quality, and water systems as a part of the patient. And so this is where we know that the healing is going to happen at the intersection of ecological health and social justice. And we've published this framework and a few others that apply it to education and also research that are helping to guide us in the tools and strategies we can incorporate into classrooms across the board with how we design safe and embodied learning environments, and also how we cultivate these multicultural, interprofessional, collaborative opportunities for deep listening practice, for awareness-based exercises that can help students to deepen their relationship and partnership with self and other. Next slide. So I wanted to just provide some kind of visual depiction or some images, contextual examples of what this looks like in real time and some of the work that myself and our team is leading. And a few images that you see here, if we go to the bottom left, this is an image of our group in Cuba through collaborative online international learning strategies and immersive study abroad programs. Our students are building what we might call like a global nervous system of care. And then some of these images you see outdoors are images of our nature-based leadership programs, where we're teaching students to treat the earth as their primary teacher to solve some of the most wicked issues that we face. And we take these interprofessional groups out for immersive opportunities in nature to learn about health system design and also leadership from those qualities of nature. The image that you see in the middle on the top, that is of that's at the United Nations Commission for the Status on Women. So we're bringing these groups into high stakes global advocacy settings to help show that the fight for gender equality and the fight for our planet are one and the same, and they're all centered on these natural laws of healing and restoration as a part of natural, healthy, flourishing systems. And then finally, up here in the top left, this is the most recent and kind of big event within our university. This is the signing of the Okanagan Charter, which is an international well-being measure commitment that our university has made that marks kind of a total redirection of our metrics of success in campus life for faculty, for staff, and for students. So we are no longer just measuring test scores. We're actually going to measure our success by our ability to foster quality of life in our students and hope that it instills those values in them as well. Next slide. And then finally, I am wrapping up here. I just wanted to land us back to what we know. And what we know is that the evidence is clear. According to the Lancet Countdown, the health co-benefits of climate action are the greatest health opportunity of this century. But we also know that the Sao Paulo Declaration, helps us understand that we cannot achieve this without a great transition. And the great transition requires us to change our social ways of being and right relationship. And so I feel really inspired by the impacts and the results that this type of nursing education, interprofessional education, all of these immersive learning experiences have brought to our students, to our faculty, to our culture, to our community. And I do believe it's the type of work that we need to do a lot more of in the North American region right now. Next slide. Returning to care is the biggest task of our time. It's going to require our personal responsibility for these ecologically conscious ways of being. And so we're really calling ourselves back to our true roots of care and healing, not just fixing downstream problems, treating symptoms, or even healing wounds, but really healing our relationship with the earth that is driving our meta crisis today. So please do reach out anytime. I put a QR code on here if you would like to connect with the Center for Planetary Health and Environmental Justice, just to meet, to talk, to share resources. I'm always open to that. And I want to thank you all for listening.
Thank you, Angelica. Finally, we'll have Dr. Julie Jacobson Vann talk about health policy, advocacy, and leadership in planetary health. So Dr. Julie Jacobson Vann, or Dr. J, as she's told me she likes to be called, is an associate professor and serves as the inaugural planetary health director at the University of North Carolina at Chapel Hill School of Nursing. She also serves as a member of the Carolina Sustainability Council and on the board of Carolina Advocates for Climate Health and Equity. Her recent work has focused nursing green teams to di-2-ethyl hexyl phthalate and engaging students, staff, and faculty in planetary health initiatives. So please join me in welcoming Dr. J.
Thanks so very much. All right, I'm gonna get started. So thanks everyone for being here. It's a great pleasure to be here with you. I'm gonna focus on health policy, advocacy, and leadership. So I'm gonna be touching on a couple of initiatives that we've worked on regionally to address climate change and other planetary health issues. Next slide, please. So I'm just gonna touch on some things we've done related to greening of healthcare, focusing on issues such as garbage, plastic, di-2-ethyl hexyl phthalate, and the Gloves Off campaign, which I invite you to get involved in because we're just getting started. Next slide, please. So garbage. Garbage is a huge health problem, not just for healthcare organizations, but for all of us. And in the healthcare systems, just in the United States, health systems generate 5 to 6 million tons of waste every year, which is about 42 pounds or more per patient bed per day. And I also read that for each pound that they use, there may be another 30 pounds of supplies used to generate each pound. And then globally, it might be about 6 metric tons, which makes it look like the United States really creates the largest waste in healthcare. Now, the problem with waste is that much of it goes to the landfill, which decomposes and creates landfill gas. And a large part of that, or about 50%, is methane, which is a strong greenhouse gas and absorbs that heat rather than letting it be reflected back to the sun. So again, it's a potent greenhouse gas. So every time somebody throws something in the garbage, I have this vision of it going to the landfill and creating climate change and then all of the destruction related to that. Next slide, please. Kind of aligned with that is the plastic problem. That's another thing I cannot stand seeing is plastic. And plastic creates climate change throughout its life cycle. And not only that, plastic leaches out microparticles and nanoparticles, which are creating large health effects. Right now, we're talking about plastics being the new smoking. And about 1.8 billion tons of greenhouse gas emissions result from plastic alone. And also, much of plastic is created from petrochemicals. So that's a political issue as well as a health issue. Next slide, please. So one of the things that we are doing, and we're working on a number of initiatives to reduce waste and reduce plastic use. And I teach a graduate course that's called Healthcare Policy and Leadership. And one of the assignments is a small group assignment to do a real green team plan. And students in this small group need to identify like one specific, and I make it very clear they have to be very specific to generate or identify one issue for each of the categories listed. Originally, the assignment focused on one for food, waste, chemicals, purchasing, and built environment. But I've changed it this year to really focus on the R's. So refuse to use a plastic water bottle. Reduce use. Don't use unnecessary gloves, which is a huge problem. Reformulating supply kits so that you're only putting the things that are absolutely necessary into those supply kits. Reusing things. We know from those life cycle analyses that it's better to use reusable gowns, reusable speculum, and also laryngoscope blades and all sorts of things. So buy reusable things, reuse reusable things like instruments. Repair or reprocess. So if you work in ENT, use or purchase the repurposed nasopharyngoscopes. And then recycling, simple, aluminum, glass, and so forth, but only about 5 to 9% of plastic is recycled. So try to avoid plastic when you can. We have a project with Norway, and when I went there last May for a planning meeting, I saw all this great reusable chucks, reusable everything. And we need to get back to that. And then rot or compost. You can contract with these commercial composters where you can compost paper towels, all food scraps, and so forth. And 3 years of my student projects are published in the paper listed here. That was in Journal of Advanced Nursing. So there's about 80 examples of student ideas for greening healthcare. If you're interested, you can email me and I'll send it to you. Next slide, please. And this just shows the steps that the students have to put into their papers: purpose statement, stakeholders, agenda, their approach, their opportunities for change, and how they plan to change it, and so forth. And I know for sake of time, we'll move on to the next slide. And then another initiative that's related to plastic is di-2-ethylhexyl phthalate. And about 2 years ago, a legislator's wife asked me to help write a bill to ban di-2-ethylhexyl phthalate from use in healthcare in North Carolina. And polyvinyl chloride is that hard plastic that's often made into sewer pipes and water pipes. It's firm, but it's used in a lot of healthcare products. And they're able to use it because they add toxic plasticizers or phthalates to make it soft and flexible. And one of the most commonly used ones in healthcare is di-2-ethylhexyl phthalate, or DEHP. And people can be exposed to it through dermal contact, inhalation, ingestion, parenteral administration as it leaches out of IV bags into the fluids. And these phthalates are carcinogens, they're mutagenic, reprotoxic, and endocrine disrupting chemicals. And many countries in Europe and other places in the world have stopped using DEHP in their products a long time ago. The United States has been a little slow to adopt these practices. Next slide, please. So in about September of, I think it was 2024, California passed a law to ban DEHP and 11 other related toxic plasticizers from IV bags and tubing. And of course, we started working on a health policy advocacy plan to do something similar in North Carolina. And a bill was introduced a year ago. And then all these agencies listed here, including the Alliance of Nurses for Healthy Environments and the North Carolina Nurses Association and Carolina Advocates for Climate Health and Equity and others. We all banded together, worked on advocacy, sent emails, made phone calls, did face-to-face sessions with our legislators. And the bill passed the Senate on June 25th and was signed into law on July 3rd. So in the next several years, we'll start to see North Carolina hospitals phasing out use of DEHP plastic IV bags and tubing. This was recently published, I believe, in January or February in Policy, Politics, and Nursing Practice. This is also another project my students do in my health policy course, as they write a health policy advocacy plan using all the steps in the paper. So I basically use the student template paper to write the advocacy plan for this initiative. So this is very exciting. Next slide, please. And the final one I want to address is medical gloves. And more than 300 billion gloves are used in healthcare each year. And a lot of them are made from vinyl, which is, ties in with the PVC and DEHP problem. So if you're a nurse and you're putting on gloves, most likely each time you do, DEHP is being absorbed into your skin. So think about the health effects. And then even nitrile gloves are derived from petrochemicals. One study showed that in one ENT and plastic surgery clinic, about 11 gloves were used for every single patient visit on average, which is crazy. But the thing is, glove use often doesn't follow best practices. And these best practices are outlined by the World Health Organization and CDC. And you might be surprised if you read the scientific literature, more glove use is not safer. We're actually finding that larger glove use is associated with reduced patient safety and increased healthcare associated infections, I think because people are feeling secure wearing those gloves and hand washing is declining. Next slide, please. So if you take a look, oops, and I'm 2 minutes over, thanks. These are some things that you don't need gloves for, and I'm going to point out one thing: vaccinations. Never in my life have I worn gloves for vaccinations. They're not needed. So work internally in your organizations to change your policies, change your practices, educate your patients, but there are a number of things that you don't need gloves for. And I will wrap up. Thank you so much for your attention.
Thank you, Julie.
Mm-hmm.
Okay, so with that, I believe we're going to go into our next concurrent sessions. So if you'd like to learn more from each of our panelists who just spoke, please join the concurrent sessions. Thank you so much, everyone.